Can you see my slides? Just check in.
Yes.
Okay, great. My name is Anna Koshikova, and I'm the Executive Director of Eurasian Movement for the Right to Health in Prisons. And I will speak about conducting CLM activities in closed settings in the region of Eastern Europe and Central Asia. A couple of words about our organization. The Eurasian Movement for the Right to Health in Prisons. It's a new regional network which is registered with an aim to actualize the issues of the right to health in prisons at all levels of decision making. We want to live in a world where the right to attainment of the highest possible level of health is ensured for people in prisons. And we achieve this through improvements in prison health policies, systems, and practices. In terms of CLM's peculiarities in prisons, there are obviously some differences compared with CLM in civil sector. First, penitentiary systems are not as much open as the Ministry of Health and other institutions that deal with healthcare. And that's why there is limited access to data in closed settings and in penitentiary systems as such. There is also a limited possibility to collect data among prisoners because there is an issue of getting access to prison, and not in every country of our region it's quite simple for representatives of community-based organizations and NGOs to enter prisons and to collect data about the barriers that prisoners face in access to healthcare services, including HIV. It's quite complicated to ensure data confidentiality and safety of respondents, and we understand that people might not be willing to disclose any data in terms of challenges they face in accessing of HIV and related services and all the healthcare services because they might be afraid to be persecuted afterwards. And there is very limited possibilities for digitalization of data collection process. As probably most of you know, it's forbidden to bring in any electronic devices inside of prisons. That's why all the data can be collected only on paper and then needs to be incorporated into digital tools for data analysis. This makes the process quite cumbersome and quite time-consuming for those who collect and analyze data. But in spite of the problems that we face and all the challenges that we face in conducting CLM in prisons, there is a specific rationale to start and continue to do so, even though most of our countries inherited the post-Soviet system of punishment, execution, and healthcare and prison settings. There are prison reforms which are starting to be implemented in our region, including the reforms of prison healthcare, when healthcare services are transferred from the Ministry of Interior, Ministry of Internal Affairs to the Ministry of Health. And that's why communities need to have mechanisms and possibilities to conduct regular monitoring of implementation of these reforms to make sure that they are done in the interests of patients and not for the reform itself. There is also an expanding range of services on HIV, TB, hepatitis, and harm reduction, and for people in prisons in our region. Even though it's a bit more complicated, especially with OAT and harm reduction, than it is in the civil sector, but these services are expanding now, and there is a need to ensure clear monitoring of provision of the services from the side of the community. There are a lot of CBOs and NGOs that are providing healthcare services and social services for people in prisons, and giving them a point of entry to the prisons. So we do have to put effort in terms of integrating CLM activities into the regular service provision. And there are mechanisms of data collection in most of the countries, and I will say a few words about this in the next slides. Last year, our organization has developed the roadmap for CLM in prisons. It's a comprehensive but very simple guide on how to conduct CLM monitoring activities in prisons. I do urge you, if you're planning to conduct any CLM activities in prisons in your countries, please refer to this document. Feel free to access it through the QR code right now or reach out to me and we can provide it. It includes all the necessary data and the mechanisms on how to start the CLM process. It includes the set of data to collect and how to collect it. It gives the possibility to design your own modality of CLM based on your country context. It has normative and infrastructural requirements for data collection and proposes means for CLM institutionalization. It has been developed in conversations with community and human rights protection activists from 8 countries of the region. So it's very practical and very simple, but at the same time, very comprehensive. What's going on CLM in prisons right now in the region? We must admit there are very few initiatives on conducting CLM in prisons of the region. There is a bright example from Ukraine where the community-based organization Free Zone has developed a mobile application, a digital tool, which is available to prisoners, because in Ukraine, prisoners mostly have access to mobile phones or to computers and computer classes. So they can use this digital tool to report on any barriers they face in accessing services. It is approved by the Penitentiary Administration. So it's really a success story in terms of conducting CLM in prisons of our region. But at the same time, there are unified instruments for conducting CLM in prisons in place. As I said, we have developed and released the roadmap on CLM in prisons. And right now we have developed instruments for data collection in 3 countries. It's Armenia, Moldova, and Kazakhstan, and possibly Tajikistan will also join. And after that, we can share our first experience in conducting CLM activities in our region. We'll present analytical briefs based on collected data to use them for further advocacy activities. And I think we will come up with some practical recommendations in terms of developing CLM activities in prisons. And my last slide in terms of key recommendations, we must see CLM in prisons as a crucial activity because usually people in prisons have very limited ability to report on the barriers they are facing compared to the civil sector where people can directly complain, they can address NGOs to protect their rights. In prisons, this process is quite limited and we cannot have regular access to data if we are not conducting regular CLM activities. We do urge to use unified CLM instruments across the region in all of the countries so we can compare data between countries and understand the situation at the regional level. We need to strengthen our advocacy and activities on country level to introduce digital approaches to CLM data collection to make it easier and to have a possibility to do it on a routine basis. We should think about institutionalization of data even before starting collecting it, because with penitentiary system, it's a bit more complicated than in the civil sector. So we do need to have clear algorithm, clear vision on how this data will be used before we even start to collect it. And there are a lot of existing mechanisms of CLM data collection in place already. They are all state-run, such as national preventive mechanisms, public oversight commissions and groups, ombudsperson office. But what we need to do is to ensure inclusion of community representatives to all of these groups and commissions, equipping them with necessary instruments to collect data on HIV and related healthcare services so they can become full-fledged actors of data collection and can include CLM activities in the work of these official mechanisms. That's all from my side. I remain online here for questions and for any other further questions that might arise after the meeting. Thank you very much.